Thank you, everyone, for joining us today at the UNM Department of Psychiatry and Behavioral Sciences Grand Rounds. We are honored today to have a tremendous speaker and longtime colleague of mine. I'm very excited to hear and support today. It is really an honor to get to introduce Dr. Gerardo Villarreal, and let me tell you a little bit about him. Dr. Villarreal attended medical school at the Universidad La Salle in his native Mexico City. He completed his psychiatric residency at the Institute of Living and the University of Connecticut program in Hartford, Connecticut, and a research fellowship in anxiety disorders at the Medical University of South Carolina in Charleston, South Carolina. Dr. Villarreal pursued additional training in cognitive behavioral therapy at the Beck Institute and has taught and supervised residents on this topic for many years. Dr. Villarreal is medical director of the Outpatient and Rural Mental Health Clinic and acting chief of psychiatry at the Albuquerque VA. He's also a professor of psychiatry and behavioral sciences and neuroscience at UNM. His areas of clinical and research interest include neurobiology and treatment of PTSD, psychopharmacology, and cognitive behavioral therapy. Dr. Villarreal is also interested in the intersection between philosophy of mind and cognitive neuroscience, particularly in the role of agency and consciousness. He helped organize the philosophy interest group in our department. It is truly an honor, Dr. Villarreal, to hand you the baton to start us off on what promises to be a very fascinating presentation today. Thank you so much.
Jeff, thanks for the kind introduction. Yeah, Jeff and I go back a long time. He recruited me to the VA over 20 years ago at this point. So we have known each other for a long time. So let me, I want to try to share my screen really quick. I'll start the presentation. So can you all see this? Great.
Yeah.
So like Jeff said, I have this interest in this intersection between philosophy of mind and cognitive neuroscience, and particularly in issues of control and agency and consciousness. And so this has been kind of a side project. And in fact, I did a grand round exactly 3 years ago to the day, in which I talked about more general principles. And today I'm going to be focusing more on thoughts, or agency of thoughts. So I have no financial disclosures. And I just want to acknowledge the, Jeff mentioned the philosophy interest group. And we started meeting before the pandemic. And we had several meetings and discussed some articles, and I did some earlier versions of this presentation. So I just want to acknowledge the group, which were Dr. Bolton, Dr. Landroot, Dr. Yaya, Dr. King. I also discussed some of these ideas with Dr. Castillo. And I also want to thank my wife, Cynthia King, for giving me some helpful feedback for this presentation. So like Jeff was saying, there's an area of intersection between philosophy of mind and cognitive neuroscience, and it's a fertile ground for kind of cross-fertilization, kind of each discipline kind of complementing each other. And so I mentioned the philosophy interest group. And some of the kind of questions in this field is, how much control do we actually have over our thoughts and actions? And so there is empirical evidence that many events that we consider voluntary are actually generated outside of awareness. And I'm not going into detail today, but I mentioned last time, for example, the experiments of Libet. And there's also a number of philosophers that argue that a lot of what we consider voluntary is kind of automatic. So there's a textbook called Decomposing the Will that is written by philosophers and cognitive neurosciences. And the introductory chapter written by Clark talks about the zombie challenge, because some of these ideas seem to agency that we're pretty much pre-programmed to act in a certain way. And so that's why they call it the zombie challenge. Now, agencies is a complex term, and this is just a short definition from the Stanford Encyclopedia of Philosophy, which says, in very general terms, an agent is a being with a capacity to act. An agency denotes the exercise or manifestation of this capacity. Now, this is a very complex area, really beyond the scope of this presentation, that has many implications for ethics and the law and so forth. And the way I look at agency, even though it's not in the definition, it implies that someone is in charge, that there's someone that is making informed decisions. And I think when we're asked to assess for capacity, in some ways, we're assessing for agency. Now, a related term, which I'll be focused on today, is what is called sense of agency, which is, in a way, the subjective experience of agency. And this is amenable to phenomenological examination. So Sean Gallagher is a philosopher at the University of Memphis, has done a lot of work on sense of agency. And this is his definition. So sense of agency is the sense that I am the one who is causing or generating an action. For example, the sense that I am the one who is causing something to move, or I am the one who is generating a certain thought in my stream of consciousness. So, for example, if I move my arm, I have the sense that I caused that movement in my arm, so I have sense of agency. Here, he also talks about thoughts, originating thoughts, even though most of his work really has focused on movement, but I want to point out that he also talks about thinking here. Now, a related term is sense of ownership, which is the sense that I am the one who is undergoing an experience. For example, the sense that my body is moving regardless of whether the movement is voluntary or involuntary. So, for example, if someone moves my arm, I have the sense that my arm is moving even though I'm not causing the movement. Normally, both kind of go together. We have both sense of agency and sense of ownership. And it's really in pathological conditions that this may be altered, for example, in schizophrenia with thought exertion. But in normal conditions, there's no separation between both. So in a later work, Gallagher expanded his ideas on sense of agency in this essay called Ambiguity and the Sense of Agency. And what he really proposes is that agency, well, it's ambiguous, but he talks about different levels. A higher order sense of agency, which he defines as depending on taking up an introspective attitude towards our first order experience of initiating and controlling an action. So in other words, if I'm planning to do something, I have this sense that I'm doing this in the future and I'm in full control of what I'm going to do. And so he refers to this as reflective sense of agency. He also talks about a pre-reflective, which is what's happening in the moment. So I'm in a situation and I have to kind of act in a certain way. So it's not pre-planned. I'm just acting in the moment. So there's a lower level of sense of agency, and he calls this a pre-reflective sense of agency. He also talks about a subpersonal level or non-conscious, which are aspects that we're not really aware of and we're not really controlling, for example, certain aspects of motor coordination. So this is a diagram from this essay. And so we have sense of agency here in the center. And it's reflective, pre-reflective, and non-conscious. This is related to the ideas of intention that other philosophers have talked about, future intention, current intention, and motor intention. And he also talks about a retrospective sense of agency. So after we do an action, then we do this retrospective attribution. I caused that action. So that's also contributes to a sense of agency. So here in this slide, I'm comparing Gallagher's sense of agency ideas. So this is a work by Rangel on decision making. And just to point out that, cognitive neurosciences and scientists and clinicians talk about similar aspects with different terminology. So for example, Rangel talks about a goal-directed or model-based decision-making. This is more kind of future-oriented. Habitual Skinnerian, which is what's happening in the moment. And classical Pavlovian, which would correspond to a non-conscious. So again, just to show this correspondence between different disciplines. So in reading the literature, there's this tension between what is automatic and what we control. And automaticity and control has also have to do with level of awareness. So things are completely automatic that we really have no awareness. And things that we have full control, then we tend to have full awareness. Now, sometimes in the literature, there's this mention of involuntary, and it can be confusing sometimes because involuntary is not equivalent to automatic. And typically we think of something being involuntary when there's no veto power. So if we think, for example, of heart rate, and there's no way I can change my heart rate voluntarily. So that is probably a demarcation when something is truly involuntary. And just to give an example, for example, when we drive, someone that knows how to drive well can do this very easily, automatically, without having to think about it, right? We tend to think of subcortical structures being involved, and we can drive, listen to music, listen to a lecture, and we don't have to be thinking about every aspect, right? But at the same time, we don't say that driving is involuntary. So it has automaticity. Now, if we're driving in a blizzard, obviously, it's going to be very different. We're going to have full attention on what's happening, and we have veto power to make changes if needed. So again, the literature tends to talk about this kind of graded difference between automatic and control. So next, I'm going to move on to mind wandering and the default network. So because it really poses very interesting questions about agency. And just to do a quick, history. So in the 90s, there was a kind of an explosion of functional MRI studies when this technique became available. So there was a lot of excitement. Researchers were doing all sorts of cool experiments and having subjects do different tasks, and then they would see what part of the brain would light up. And then they would compare the kind of baseline and the difference that would be the activation. And then the rest was thought to be noise. But then people started noticing that when subjects were focused on external tasks, there were parts of the brain that would shut down. And then when they were not performing tasks or distracted from the task, some areas would activate. And they noticed that these areas would kind of co-activate together. So this idea of the default network started emerging in the late 90s, early 2000s. So this is a slide just showing a mapping. So in the lower area, this is a group average among subjects. And these are the areas that suppress when the subject is focused externally. In the middle row, we see areas that can co-activate at the same time. And if you see, there's a lot of overlap between these same areas. And in the lower row, these are areas that actually activate with internally oriented tasks, for example, autobiographical recollection. And so this is kind of the default network that deactivates when we're focused externally, is active when we're resting, and even activates further when we're directed inwards. What happened too is that when people would ask subjects, for example, when they were distracted, what was happening, so subjects would say, well, my mind was wandering. And so that's why we start seeing this kind of correlation between the two. So again, just to repeat, so deactivates with external oriented task, and is antagonistic to only one network, which is the dorsal anterior network. That's the only network that is opposite to the default. All the others can co-activate. And just some interesting facts, the default network, also known as the full mode network, uses most of the brain's energy, about 60 to 80% of the energy. And this is kind of fascinating because if we think mentally we're in a resting state, but we're using a lot of energy. And there's also emerging evidence that there's dysregulation in this network in pathology. For example, there's increased connectivity in major depression, decreased connectivity in Alzheimer's, schizophrenia, and PTSD. The other interesting thing about the default network, which I was alluding to, is that it activates when we're doing internally oriented tasks, like, for example, memory retrieval, which seems a little counterintuitive if we think that during mind wandering, the mind is just wandering and not involving goal-directed thinking. And I'm referring here a lot to a work by Christina Christoph and Kalina Christoph, who is a professor of psychology at University of Alberta, and wrote this very interesting theoretical paper in Nature with Neuroscience in 2016. And what she argues, and makes a very compelling argument, is that a sub-region of the default network refers as the mediotemporal lobe region of the default network, is where the spontaneous thought arises. And I won't get into all the evidence, but she makes a really good case that this is where thoughts are originating during mind wandering. So what is mind wandering? So the typical definition is task-unrelated or task-independent thought. Again, this is based on neuroimaging studies. So when the subject is not paying attention, it is implied that they're distracted and their mind is wandering. But there's been a lot of debate about what is a really good definition. And because by definition, the mind is wandering, from one topic to another. And one quality that I would like to point out, and it's not mentioned a lot, is that it's effortless. For me, it's the main quality of mind wandering is that there's no effort. And it's triggered by low difficulty tasks. So if you go back to the driving example, when we're driving and it's a well-learned task, our mind tends to wander, and it's common. It can happen, for example, that we'll drive to work on a Sunday where we don't need to go to work. And the focus of attention is internally. Now, Schooler talks about a process that she terms perceptual decoupling, meaning that there's less attention externally, and experimentally subjects, for example, make more errors or have longer reaction time because they're not as focused externally. Another aspect that is also fascinating about mind wandering is there's no awareness. So when we go into mind wandering, we don't realize that's happening. And Thomas Messenger, who's another philosopher, describes this as that we become protagonists. So we become a protagonist in this fantasy, and we're not aware. Now, Schooler talks that the end of the wandering episode is when we realize we're mind wandering. And she calls this meta-awareness. So, so she proposes that mind wandering starts with this decoupling aspect and then ends with meta-awareness when we realize our mind is wandering. Now, other interesting facts about mind wandering is that we tend to think as purposeless, but in studies looking at sampling of subjects, of non-clinical subjects, they found that majority of them during mind wandering were thinking about personal goals. In another study that I mentioned here was very interesting. They had normal subjects, and as part of the study, they told them they were going to have a geography test at the end. And then they did a sham experiment. And then they tested mind wandering while they were doing this task. And they found that most of them were thinking about geography. Again, meaning that they knew there was going to be a test, so they have this internal goal, even though they're not consciously thinking about it, to think about geography. Another aspect that has been described can be the stickiness of thoughts, and this has been described for depression. And so meaning that especially when there's strong affect, that tends to pull the thoughts. And so we think in depression, this rumination, or an anxiety, this worry. So the thoughts tend to go to this topic of with high affect. And so essentially, mind wandering is, in my opinion, similar to what Freud was assessing when he developed his free association method. And so he essentially was sampling subjects and telling them just to verbalize their mind wandering, within the context of the therapeutic session. So Kalina Christoph provided this definition, which gets a kind of a way of some of the problems with mind wandering. And she proposes this idea of spontaneous thought, which she defines as a mental state or sequence of mental states that arises relatively free due to an absence of strong constraints on the context of each state and on the transition from one state to another. And it's very interesting because she talks about mental states, which is richer than just thoughts. And I think we can even say consciousness states. And what she proposes really a spectrum between dreaming and goal-directed thinking, just in the level of kind of control that we have. And she talks about two types of constraints on spontaneous thought. A deliberate constraint that is conscious and volitional. So when we can make an effort and can alter, our train of thought. And also automatic constraints that are based on affective and sensory salience. And essentially what she's saying is that really the only deliberate or voluntary control we have is through the frontoparietal control network, also known as the central executive network, that can focus internal and externally oriented goal-directed thinking. Now, the interesting thing is that this executive network can also be activated during mind wandering, which again can be a bit counterintuitive. We think of mind wandering as being purposeless. And this is just a quick diagram of the networks according to Christoph. There are different classifications, but this is the default network with 3 subcomponents: dorsal anterior network, the salience networks, and the executive control networks. And so outside of the executive control network, pretty much everything else is automatic, according to Christoph. So the dorsal anterior network focuses attention externally, but does it automatically. And the salience networks also automatically redirect attention to salient stimuli. So typically salient stimuli are either some reward or challenge or some affective stimulus. And both provide automatic bottom-up salience detection. So they both capture the system in an automatic way. So Christoph kind of puts all of this together in this diagram, again, proposing that the medial temporal lobe is the main source of thinking. So if we think of the stream of thoughts as a river following William James, this would be the spring where the river is arising. And then we have these automatic constraints that will kind of guide the river in an automatic way, the salience and dorsal anterior network. So we have the variability with these purple arrows, and then the automatic constraints with the blue arrows. I just my dictation software is acting up. And then the only voluntary control we have is with actually the control network here with the red arrows that will, in a conscious and voluntary way, modulate the rest of the networks. So just to give you an example that Christophe has in her paper. So here we have 3 columns. In this column is spontaneous thought. And I won't read in detail, but this is a person who's going to a store and is thinking about an upcoming ski trip and is reminiscing about snow. So I have these associations around snow. And so in this case, the middle temporal lobe is active and is generating these associations with snow and is kind of capturing the system. When this person crosses the street, then remembers that she has a deadline, has a paper to submit, and starts worrying about the outcome and losing her job. So anxiety starts kicking in. So in this case, the salience network is detecting a threat and then is capturing the system towards this upcoming deadline and anxiety around it. And in the last column, the person gets to the store and realizes that it's feeling miserable, and then makes a conscious effort on what she's going to buy, went to the list. So in this case, the executive control network is taking over and kind of regulating the other networks. But I think the kind of message here is that everything is happening very automatically. And it's only here that really the person is in full control. So that brings us to the question of, is there cognitive agency? So there have been studies, this is a very important study by Killingsworth, looking at sampling. They use smartphones and use thousands of subjects in which they would send random signals and they would have to report if their mind was wandering at the time, and that's when they were awake. And they found that 50% of the time, subjects reported that the mind was wandering. And even when they were involved in a task, still 30% reported their mind was wandering. So this is just to point out that this is very, very prevalent. Suggests that about half of our wake time, our mind is wandering. So going back to the ideas of Thomas Messenger, this is a paper that he published some years ago that is very influential and in some ways controversial. And what Messenger is saying that this cyclical loss of autonomy, when we go into mind wandering, that there's a loss of agency, essentially. And he calls this a self-representational blink. Like we go into this automatic, non-agentive state. And we only have really agency when we come out of it. And he describes attentional cognitive agency. So attentional agency is kind of a conscious effort to shift attention to a specific stimulus. And cognitive agency is this ability to control our task-related and deliberate thought. And so both require effort. And so more from Metzinger, he says, human beings, although phenomenally conscious, are not autonomous mental subjects for roughly 2/3 of their lifetime. He also says, conscious thought primarily and predominantly is an automatic subpersonal process like heartbeat or immune regulation, and which I think is a bit extreme when he talks about heartbeat, but I'll kind of go back to that. But he's really questioning this idea of mental agency. So in the last part of the talk, I'm gonna do an exploration of some of these ideas, using mindfulness meditation. So there's been a lot of interest in mindfulness meditation and mind wandering because it is really a window into what's happening. My personal experiences with Zen Buddhism, I practice with 2 different schools, one Soto school, which is a Korean tradition, and Rinzai school, which is a Japanese tradition. And so then meditation is a very unique situation because we're not engaged in any activity. And typically the only instruction is, particularly in Zen, is have your eyes open, sit in a certain position, and focus on your breath. And then you're pretty much on your own after that. So what happens when we do this? Typically, I'm able to pay attention to the breath, but I can do it for a few seconds, and it requires effort. But then suddenly, I get distracted, plans, worries, memories. And so this effortless and kind of automatic flow of thinking starts. Then at one point, I realized that I lost track. And then I make a conscious effort to refocus on my breath. And this requires effort. And then I get distracted again. So the cycle repeats multiple times. And I'm talking here only about early meditation stages. I don't claim to be an experimentator, or I'm not going to try to describe what happens in more advanced stages. But this is kind of the initial stages. And so there's this cycle of distracting and refocusing, distracting and refocusing, and very personal and emotional topics present. So what I'm going to try to do now is provide you with a sample of my own thinking to kind of demonstrate some of these aspects. And I'm going to use a method, or try to use a method called micro-phenomenology. And I want to thank Rochelle Lengroot for sharing this article from Petit Meningin about this method in meditation. So micro-phenomenology really grows out of phenomenology, which was developed by Edmund Husserl, who was a German philosopher who worked in the late 19th century and early 20th century. And so it's really kind of grows out of this. And it was developed by French psychologist Vermeersch, but also influenced by Francisco Varela, who did a lot of work with consciousness and developed this idea of neurophenomenology. And so actually, there's a website I just discovered recently, and it's a community focused on micro-phenomenology. And I'm just quoting from the website. So it's a method that enables us to explore lived experience in very finely. What's happening when an idea comes to us? We can learn to describe our experience very accurately and reliably, and discover its ordinary, inaccessible dimensions through appropriate methods. So they actually have even an interview that they use to really try to capture like fraction of a second changes in the kind of the subjective experience. So what I'm going to try to do next is provide you an example, trying to use this method of my own subjective experience while meditating. So this is just a description as close as I can to my experience. So I am sitting, focusing on my breath, and I notice a sensation in my chest. And then I have a thought. I am anxious. Why am I anxious? I have to prepare for dinner tonight. There's still a lot to do. That's probably why I'm anxious. So I have these images of cleaning, preparing dinner, and so forth. So that's probably what's making me anxious. However, so I'm putting in quotes my thinking and in parentheses the images. However, I'm still able to relax to some degree, not like my patient X. So I think about one of my most anxious patients. So I imagine him sitting in my office. He's one of my most anxious patients. He can never relax. And I didn't put it here, but I also had a thought, I can relax to some degree. Then I think I could refer him to repetitive transcranial magnetic stimulation, or RTMS. We discussed referring PTSD patients in our last meeting. So then I have these images of the meeting when we discussed this, and images of my patient sitting in the room looking anxious and shaky. Then I have a thought. It would be very stressful for him to come to treatment every day. But Nurse Holly is very nice. So then I had these images of Nurse Holly talking with the patient and making him comfortable, smiling empathically. She would make him feel comfortable. And at that point, I become aware my mind is wandering and I refocus on my breath. So, here, I think meets the criteria for mind wandering from the moment that I'm refocusing on my breath so that the task is focusing on breath. And everything that happens after is task unrelated and ends when I refocus on the breath. So to interpret this, I'm gonna kind of incorporate some of the ideas of Gallagher and Metzinger. And what I propose is using a term, sensory-cognitive agency, to again combine Gallagher's and Metzinger, which is similar to what Christoph calls deliberate constraints. So in yellow is the micro-phenomenology, and in white is the sensory-cognitive agency, and these are transition states, and this is pre-reflective sensory-cognitive agency. So when I'm focusing on my breath, I'm making an effort, a full kind of voluntary effort to focus on my breath. So in that case, I argue that I'm really in a state of full reflective sensory-cognitive agency. Then I notice an anxiety. So at this point, I do agree with Metzinger that I don't know where that is coming from. That is non-conscious origin. Is the feeling. But then I label the feeling. I have anxiety. So I argue that here, then there's some sense of agency, pre-reflective, that I'm putting as a one. I'm kind of trying to understand what's happening, so I'm labeling it. Then I think about my patient, so I'm putting my anxiety in context. And so this image of my patient comes. So I argue that here I have slightly more degree of sense of agency when I'm putting it in context. Then I think about treating him using RTMS. And again, I'm trying to problem solve. So I experience a higher degree of sense of cognitive agency. Then I think it will be difficult for the patient. So I imagine that the empathic nurse helping him. So I propose that again, it's a slightly higher sense of cognitive agency. And then when I do a conscious effort to refocus on the breath, I have full reflective sense of cognitive agency. So what I'm trying to propose here is that this is a more nuanced. To Metzinger, everything that's happening here is like a heartbeat. And I argue that there's more nuanced, and they are parts are non-conscious, but there are others in which there's some goal-directed thinking, and I do have a sense of control. So some thoughts on the micro-phenomenology. So this sample took about just a few seconds, and I'm guessing 5 to 10 seconds. Now I had to stop afterwards, think about it, and translate it into words. And like I said earlier, more than thoughts, these are really consciousness states. So there's meaning, there's thinking, there's meaning, linking the thoughts, there's imagery, and there's affect. So I think just saying thoughts doesn't kind of capture the richness, which is more of a consciousness state. And when I describe it using language, I'm able to remember it, but otherwise I would forget it immediately. And I'm also able to communicate. So what do we conclude from this? So spontaneous thoughts generate constantly with different degrees of automaticity. So anybody that has meditated can attest to this. So we're always thinking about something. Here I identify at least 4 levels of pre-reflective sense of cognitive agency or deliberate constraints. Now I sense that the thoughts are mine, So these are my worries, my desires. So I have a sense of ownership, a complete sense of ownership. But perhaps there's some dissociation from sense of cognitive agency, in the sense that I not necessarily want to think about it at the moment, but I always sense distinct thoughts as mine. And like I said earlier, a very important quality is that it's effortless. I'm really not making an effort to think about this. So, so what I propose here is that the initial state, when I first experienced anxiety, does originate outside of awareness, but not the majority of the transition states. So in this point, I disagree with Metzinger that he thinks all of it is non-objective. And from my perspective, only the initial event is completely non-objective. And as the associations progress, I have an increasing sense of cognitive agency as I get to the next thought and the next thought. And then the end state, when I refocus on my breath and requires effort, that's when I feel I have full reflective sense of cognitive agency. So that kind of marks the end of the episode. So if we put this in a diagram, so on the left side, we have automatic. In this case, would be the anxiety. This would be automatic, non-conscious. But as I move through my associations, I have this gradual increase in sense of cognitive agency. Even if I'm off task, there's still some goal-directed thinking. And then when I refocus on my breath, I have this, again, this full sense of cognitive agency. So if we go back to the idea of the zombie challenge, from my perspective, yes, a lot of what happens is automatic, but we do have some control, but it's kind of based on the time horizon. So the farther in the future, the more control we have. Perhaps in the moment, we may have some automatic unconscious reactions, but if we have more medium and longer term goals, I do think we have a higher both sense of agency and agency. So we do have more control for, we look in the future. We can think of the agent as a CEO of a company that may not be necessarily aware of everything that's happening in the company and how certain products are created, but can direct the company to certain, in certain way to a certain goal, even though may not be aware of everything that's happening in the company. So even though this is not a clinical presentation, there are obviously clinical aspects of this, and we could argue that there's loss of sense of agency in pretty much all psychiatric conditions, probably more prominently in schizophrenia. But if you think of patients with PTSD that have intrusions and avoidance, OCD with obsessions and compulsions, anxiety and depression, and substance abuse. So there's, I would say, probably in all psychiatric disorders, there's some less loss of agency. So, so I went a little faster than I was planning, but that's all I have. I want to leave you just with a quote from Lennon and McCartney from this song called "I'm Fixing a Hole," which I think is related to mind wandering.
Thank you, Gerardo, for an amazing talk, integrating so many concepts. Really, really tremendous to sit and listen to you and track my own breathing and watch my mind at the same time as and wondering how in the world you could actually capture all that after your experience. So, so thank you so much and for sharing your experience. It's just so compelling. So, thoughts, questions, comments, ideas. Put them in the chat or raise your hand or just speak out, whatever you feel.
I was going to do a sampling of mind wandering, but technically was kind of complicated, but I was going to ask at one point, see we're distracted.
So I have a question, Gerardo. Can you hear me?
Yes, yes.
So thank you for your presentation, Gerardo. It was I think it was very compelling, and it makes you wonder a lot. And I wanted to ask you, hearing you describe your little sort of vignette of micro-phenomenological description and your analysis of that description in terms of you're aware of thoughts and feelings and different sense of agency. It just made me think a lot. A lot of those concepts are CBT kind of concepts. And I was wondering if you're aware of anybody trying or talking about implementing some kind of homework assignments of a micro-phenomenological recordings during mindful meditation, and whether those can be in some way used during CBT sessions. I know it sounds like a long shot, but I was just curious.
Not specifically, but there's obviously some overlap. So Beck, for example, talked about automatic thoughts. And if we think of like schemas, so these are kind of automatic ways of processing information. And there's even a description of a dual information processing system, one automatic and one deliberate. And so the automatic needs to process information kind of faster and can make mistakes. And that's when we tend to have unconscious biases. And a deliberate that is voluntary and can modify that or can do reality testing. So I think a lot of what's happening in CBTs, we're using this reflective system to kind of reassess these thoughts. And this mindfulness is being used more and more in psychotherapy, but I'm not aware of specifically micro-phenomenology being used in this respect. It's kind of a growing field. It's a community dedicated to that.
Gerardo, thank you for a great talk again. And this question is actually going to exceed what you presented. So forgive me, it may not be at all what you want to talk about, but it sounds like over 50% of our time is spent with mind wandering. So it's almost like there are two states. There's the non-agentic state of mind wandering, but then there's the agentic state. And I was wondering if you have any hesitancy or you see a gradation of agency in that other state. In other words, if it's not non-agentic, is all agency full agency, or is it limited? And I'm particularly interested in suicide, whether suicide can be non-agentic, in other words, whether it can be determined, even if it looks like it's agentic. Does that make sense? So it's not in this sort of quiescent, quiet mind. It's more in the full awakeness. Is that full on agentic, or is there limitations to that?
Well, I'm not sure. I think we're constantly going between both states. It's not like we're set in one state. I think we're constantly going back and forth. So I don't know, maybe in an impulsive action, maybe it's happening more in this less agentive state, but I'm not sure. But I would say that it's very dynamic. We're kind of going back and forth all the time.
Gerardo, I was wondering, I've long been interested in this, and it has to do with kind of my interest in improv and what happens between two people. But when I'm doing that, or when I'm creating something with another person, I have less experience of mind wandering when I'm in a collaborative experience or state of mind. And I'm wondering, even from this model, if there's anything to say about the presence of another person or the collaboration with another person that impacts our degree of mind wandering?
Yeah, I mean, I'm pretty sure. I mean, I'm not familiar with specific literature, but I do think that one person influences the other. That external stimuli influence our own wandering, and then we influence the other. So I think it's like a dance that we're interacting with each other. And I think in improvisation, you're at this kind of pre-reflective, just kind of acting at the moment and being spontaneous.
But there's a way that when you're collaborating with another person, you almost protect from the mind wandering state.
But I think your own state kind of comes into play and influences the other person and vice versa.
Right.
Not sure if that answers the question.
No, it does. It's kind of a huge question about relatedness in general, but it's just so interesting to me.
Dr. Villarreal, kind of on a somewhat related is creativity and thinking about what's the relationship of mind wandering versus agency and doing creative activities. And I think of improv as being sort of one mode of that, but is that something that's come up in the work you've been working with?
Oh yeah, let me actually share one slide from Christophe that I didn't include. Can you see it? Let's see.
Not yet.
Not yet. Hold on. Oh, I have to share my screen. So this is one slide that I didn't introduce, but this is from Christophe. So she talks about this kind of continuum between dreaming and goal-directed thinking. And as we go to the right, there's more deliberate constraints. And as we go up, there's automatic constraints. So she talks about creative thinking being in a kind of between mind wandering and goal-directed thinking. And I think I find myself during mind wandering, or even when falling asleep, sometimes that's when I find solutions to problems in that state that is less structured. Sometimes that's when solutions come to mind.
That there's a difference between that and the rumination obsessive.
Yes,
Yeah.
yes, because here is constrained or sticky, so you're just kind of stuck in a loop.
Mm-hmm.
So it's not very creative.
Dr. Villarreal, I just want to take a moment to thank you for giving this presentation. It was exciting to hear about this novel, interesting idea and your exploration of it. So thanks for that curiosity. And then I also want to thank you for sharing your own private mind with a giant group of mental health professionals. And I appreciate the courage that takes to do so. And I'm glad I'm not the only one who kind of frets about what to make for dinner. So thank you.
You're welcome. Yeah, I choose something somewhat more neutral, but typically there's like high personal and affective content.
Dr. Kreisman, Avi, you put a reference in the chat. Was there something about the article that's good to share?
Oh, well, thanks. I'm sorry my video is not, I don't have enough internet to do video today. But this was a wonderful, wonderful talk. I really like this article because it really makes a distinction about the whole idea of consciousness is like all the predictions that we make and all the frames in which we make those predictions. And so a lot of it is what we label as mind wandering and what we label as creativity. And so they make a good point about how we attend to and frame the same kind of phenomenon, and seeing agency and mind wandering as part of a continuum as opposed to two separate states.
Thank you. Look at the reference.
Thank you. Thanks for that. Other thoughts or questions in our last couple minutes? Gerardo, if you want to stop sharing, we can wave goodbye to each other.
Oh, yeah, sure. Sorry.
That was a deliberate thought. So thanks again for a fantastic talk. Any last questions? All right, everybody, then see you next Friday. Thanks again.